2,993 from Wuhan. Newly cured and discharged from hospitals, 2,570, including 1,958 from Wuhan. New deaths, 42, including 32 from Wuhan. Remaining confirmed cases, 30,543, including 25,903 from Wuhan. Severe cases, 6,872, including 6,225 from Wuhan. Cumulatively cured and discharged from hospitals, 33,757, including 21,185 from Wuhan. Cumulative deaths, 2,803, including 2,227 from Wuhan. Cumulatively confirmed cases, 67,103, including 49,315 from Wuhan. New suspected cases, 80, including 70 from Wuhan. Remaining suspected cases, 527, including 340 from Wuhan. And from Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 148, including 98 in Hong Kong, 10 in Macau, SAR, and 40 in Taiwan region. Apart from Hubei province, in all the other provinces, new confirmed cases, 6, new suspected cases, 61. There is no new deaths. Severe cases were reduced by 20. New confirmed cases and new suspected cases in the past 2 weeks have shown a general downward trend. Newly hospitalized, newly discharged patients have seen some fluctuations around 3,000. And this information has shown that the peak is behind us, and sporadic eruptions in other provinces have also been curbed. The overall trend is towards the positive. For the next step, we should have a holistic plan, focus on community prevention control and medical treatment. We should shift from the holistic and overall prevention control to more precision policies. Now we'd like to take questions from the floor. You may ask questions related to today's topic. Please identify yourself before you ask your question. First question, please. Journalist from the first row on the right side. With CCTV Group, Premier Li Keqiang has emphasized on the Party Central Committee work meeting that the resumption of businesses and the resumption of normal life should be promoted as businesses are gradually restarting their business. They are seeing workers trickling back to workplaces. What are the measures that we should focus on to prevent against the spread of the disease at workplaces? I'd like to ask DDD Zhou Yuhui to take the question. In communities, they should follow the community prevention and control protocol. The grid management system and the carpet searching method should be continued. Health check, inspection, health declaration, and screening should be continued. For people coming back from epidemic hit regions and areas, community staff should pay close attention to this group of people. They should be reminded to registrate with the community. And for those who have stay-home quarantine, communities should follow up with the close monitoring of their health conditions. Once fever, dry coughs, and other respiratory tract symptoms are identified, they should be urged to seek medical services at adjacent health institutions. Besides, such information should be reported to the local disease control institution. We'd like to urge those who have come back from the high-risk regions, please be responsible to yourself, to your family, and to the whole society. Please stay home for medical observation. Once you find yourself being uncomfortable, you should timely report to the community and promptly seek medical services. We'd also like to remind those to collaborate with the community staff, the medical workers, and all those who are engaged in the frontline work. They are working pretty hard. We hope that we can join our hands and give play to the role of the mass prevention and control strategy and resolve to win the battle. Thank you.
据媒体报道，有一些养老院出现了疫情，感染者包括院内的护工、在院老人和院长。
Those are some of the regions some of the areas which is quite contingent, and the protective equipment in these areas is relatively underprepared. For those of the institutions who has seen the epidemic occurred or those who has never seen it occurred, how do we do the protective and prevention measures? Thank you very much for your question. Those aging institutions is a very important places, especially for the protection and control of the COVID-19. You mentioned about two categories, those who have seen the cases and those who have not. For the first scenario, they should focusing on the four following up works. And first, they should do the day-to-day body temperature test for the nurses, elderly people, among other different staffs. Second, they should do a good health management for the elderly people, the nurses, among other different works. Thirdly, the elderly people, if they find any symptoms like high fever, shortness of breath, they should contact
cases. For those without cases, 4 jobs need to be done. First, the nurses and the elder citizens must be under temperature monitoring and prevent against imported cases. Second, for the elder citizens, in particular those with chronic diseases, their health must be properly managed. Third, once there is discomfort revealed in these elder citizens, the nursing home should immediately contact their family members. Upon consensus, they should be transferred to medical institutions, or they can make a call to the health institutions and ask doctors to come, or they can dial 120 for emergency health services. Family members can also be asked to provide transfer services. If the nursing home is well conditioned, the staff there can be accompanied as well.
Firstly, when they return from the clinics back to the nursing homes, for both the elderly and the accompanying people should be quarantined for 14 days for observation. Secondly, for nursing homes with healthcare services, apart from the above-mentioned measures, they can also have 3 extra measures. First, once a case is confirmed or there's suspected cases, such cases should be quickly transferred to the designated hospitals and quarantine measures should be taken. Second, the cases should be reported to the relevant authorities and guided by the local competent authorities, relevant measures should be adopted. And thirdly, for people returning from the designated hospitals, they should be quarantined for another 14 days for observation. Let's continue. On the left, on the third row, the lady reporter. Thank you. I'm from the Enterprise Observation newspaper. Recently, construction sites have resumed their operation. However, for construction sites, there's a risk of work in enclosed or indoors, and how to guard against the risks. Dr. Shi, please. Thank you for your question. It is fair to say that the work resumption is critical for the recovery of the daily operation and the economy. For workers working in the mines or in the enclosed places, ventilation should be guaranteed. Especially the surfaces they contact and the production tools and the facilities should be well disinfected. And with conditions available, disinfectants must be used. And here, pay attention that non-alcohol-based disinfectants should be used, and every day there should be appropriate disinfection measure. When working under the mines or in the mines, the production tools should be disinfected and hand hygiene should be emphasized. Also, the daily temperature monitoring should be strengthened, especially for workers live in the dormitories. The body temperature monitoring should be checked on all the people entering the construction sites and the dormitories. And once there's abnormality identified, then the suspected personnel should be quarantined in a dedicated place. And also, for the workers' dormitory, there should be adequate ventilation. For dormitories without windows, there should be ventilation facilities well equipped. And also, there should be regular disinfection and sound hygiene practices. Thank you. Let's continue. On the right, on the second row, the third reporter there. Thank you. From Phoenix TV. Previously, it is highly emphasized the 4 earlies. Now, at this stage, for localities outside Hubei, where there are not many new cases, what are the specific measures to be adopted? DG Zhou, please. Thank you. Early reporting, early detection, early quarantine, and early treatment are the 4 major interventions against epidemic. The early detection and early reporting are the basis. In summarizing the previous experience against the epidemic, we organized experts to work out the 4 early protocol. And also, we have set up a monitoring system against the epidemic. In this system, there are many member agencies, including healthcare facilities at different levels and disease control and prevention institutions. With case monitoring report, epidemic monitoring, and community-based monitoring, as well as the business-based monitoring, we have strengthened the monitoring over the epidemic. The community-based monitoring and the business and individual monitoring are emphasizing the role of the communities and the businesses. They should soundly manage the people in the grid, and in terms of health monitoring and personnel management, relevant measures should be well adapted. Once a case is identified, they should immediately report to the local CDC or the healthcare facility in order to strengthen our early reporting and detection capacity. Thank you. Let's continue. On the left, on the second row, the journalist in blue. Thank you. From CCTV News. Netizens are very interested or concerned about the public transportation facilities as people are back to work. So how to strengthen the safety in these public transportation facilities? DG Zhang, please. Dr. Zhang, please. Yes, indeed, it's a hot topic of a lot of concern. I think we can approach this issue from two aspects. First, for taxis or hailed cars, they can have quite independent space. And the second is for public transportation facilities like the subway. So they should be treated differently. Let me first talk about the taxis and the hailed cars. I think we should pay attention to 5 things. First, to ensure the drivers are safe and they are not infected. So to do so, we can set up a health declaration system and conduct the temperature monitoring. Also, we should remind the drivers to wear the masks throughout the service, and also, when necessary, keep their hands clean and disinfected. And second, for the vehicles, every day before the vehicles are being operated, the car handles, the door handles, the seats, and etc. should be disinfected and cleaned. Thirdly, during the driving, if possible, when the outside temperature is appropriate, try to have the doors or the windows open to ensure sound ventilation. And fourthly, for the passengers, before they get into the car, they can open the door for 1 or 2 minutes so that the indoor air can be freshened.
Passengers can also use the disinfectant napkins to clean the places indoor where they can touch. And also we suggest the passengers to wear masks throughout the ride. And after you get off the taxis and public vehicles, we suggest the hand hygiene efforts again. And the payment should be made without cash. For public buses, there are 4 points that we should pay special attention to. First, the bus companies should schedule the buses according to the traffic flow so as to reduce the crowding in buses. Second, if conditions allow, in the ride, ventilation is recommended. If it is a bus with a centralized air conditioner system, disinfection frequency should be increased. Be it the driver, the bus assistant, or the passengers should all wear masks. Fourth, passengers should have social distance in the ride. And after the disembark, hand hygiene efforts are again recommended. Subway. In subway, work may be smoother and easier because there are fixed places and stations. So there are 7 points of recommendations. First, again, the crowd control and the traffic flow control to limit the number of passengers for a certain time slot. Second, temperature monitoring should be conducted at each station. Third, disinfection frequency and cleansing frequency should be enhanced. The air conditioning system at the stations must be checked to ensure its smooth running. Fourth, the carriages should be disinfected and cleaned. In particular, the air conditioning system in the carriages must be of good function. Fifth, staff for the subway must wear masks. Sixth, we should make full use of broadcasting system and the in-subway screens and bulletins to give public knowledge. And the passengers throughout the ride should wear masks. And again, after disembarking from the subway, they should have hand hygiene efforts again. Next question, please. Journalist from the second row of the left side. Thank you. Among the 15 technical guidelines provided, one is targeting at psychological mental health institutions, and in South Korea, there is one case of 99 cluster cases in a mental health hospital. Some believe it is because it is a semi-closed environment, and for mental health patients, they have a special difficulty in communicating with the physicians. So what should be the special measures adopted for the patients with psychiatric distress and disorders? Thank you for your question. Mental health institutions indeed is a very special health institution. Mental health institutions, because of the difference in the patients that have been accommodated, should do parallel efforts. On one hand, they should work out plans. They should have medical supplies. They should ensure disinfection and cleansing of the in-hospital environment. They should have frequent ventilation. And on the other hand, they should give consideration to 3 special points. First, on the front of diagnosis and treatment, mental health institution should collaborate with a comprehensive hospital with the capacity of treating and diagnosing novel coronavirus pneumonia. Those who are working in mental health institutions should get special training on not only the diagnosis and treatment, and also the self-protection. We should shorten the hospitalization period, suspend family visits, and restrict the number of family members who are accompanying the patients. The new enrolled patients should be put on a certain period of quarantine before they are transferred to ordinary wards to prevent against the importation of cases. Second, in institutions like this, there should be stepped-up efforts on those with serious psychiatric distress, and reduce and minimize their travel outside the hospitals. Third, For those patients, once identified with suspected or confirmed cases, immediate quarantine must be adopted, and they should be promptly transferred to designated hospitals for treatment. For those who are difficult to be transferred immediately, mental health institutions should immediately set up a special isolated zone and invite doctors who are capable of treatment to come over for consultancy health services. Thank you. Journalist from the third row on the right side, please. Thank you. With CNR of the CCTV group, weather is warming up and people want to go outside, and in some scenic spots there is already a crowd of people, and these tourist destination has new measures such as the control of the people flow and the limit of numbers. Some of the hoteliers have opened business as well. So for places like this, what are the recommended prevention control measures? Thank you. I'd like to ask DG Shi Xiaoming to take the question. Thank you for your question. This is a question widely concerned by the netizens. For places as such, we should emphasize on the preparation before the resumption of business, in particular the supplies, the stockpiling of masks, disinfectants, hand sanitizers, and temperature monitors. Besides, thorough disinfection and cleansing should be conducted in such public places in a preemptive way, in particular the lavatories, the public dormitories. And the places as such, after they opened their business, they should do a good job in the following three aspects. First, continuous temperature monitoring for the customers or the visitors. I've emphasized this point previously. This is of paramount significance. Second, ventilation is highly recommended. In well-conditioned places, the ventilation fans can be operating all the time, in particular in lifts and in the underground parking lots. Third, disinfection, cleansing should be emphasized, in particular those which people are frequently touching, such as the buttons for the lifts and the switches of the lights. Fourth, garbage should be classified and treated in different classes. The surfaces of the dustbins should also be kept clean. In the washing rooms, it should also be kept clean. The washing basin should be clean, and the toilets should be clean.
If conditions allow, there could also be remote sensing hand sanitizer facilities, and also the employees can be well coordinated to take breaks in turn. And in cases of suspicious cases, there should be designated sites for temporary quarantine. And also there should be health promotion campaigns or promotion materials or posters. Thank you. Let's continue on the right, on the third row. From the cover.cn, we know that there has been the graded and the zoning measures adopted, then how about the public swimming pools, and how can people protect themselves? Well, Professor Zhang, well, I think it is not advisable to go to the public swimming pools or the bathrooms. So my suggestion is for these public facilities to remain shut. Then after the epidemic, once the public swimming pools and the bathrooms are reopened, then there should be appropriate disinfection measures. The regular disinfection measures include the overall cleanliness and the disinfection. Also, for the centralized air conditioning system, there should be appropriate disinfection and sound ventilation. Also, for public products used like the towers, there should be sound disinfection, and also for the water in the swimming pool should also be well disinfected. Thank you.
救伤的安全是我们整个疫情防控过程当中的一个关键的环节。那么应该做好以下这6个方面。第一是要建立餐厅员工健康体检的制度，每天对食堂工作人员进行体温测量和身体健康监测，并且要做好记录，严禁带病上岗。第二是要加强环境物体表面清洁消毒，做好餐饮区的清洁消毒，要确保做到一人一具一用一消毒。
Restaurant or the dining halls and make sure that the utensils are well disinfected. Third, sound hand hygiene practices. The dining halls should have the quick dry hand sanitizers, and if conditions allow, they should have the remote sensing hand sanitizers. And fourthly, the restaurants or the dining halls should go to the qualified supermarkets or the wet markets to get the raw materials. And also there should be good practices in preparing the food, and the overnight food should not be served. Fifthly, emphasizing the ventilation of the dining hall. In sunny days or good weather days, the restaurants or the dining halls should open the windows and doors to make sure the fresh air inside the restaurants or the dining hall. Furthermore, for people who come to these public places, like the supermarkets or the shopping malls, there should be appropriate measures adopted to ensure the health for all. Let's continue. On the left, on the fourth row. From CCTV, the financial channel. Recently, the State Council issued a circular requesting the zoning and the grading practices. How about the catering sector? Thank you for your question, and DG Zhou to answer your question. Thank you for your question. Our Commission is implementing the State Council's policy for zoning and grading of the various areas, and experts have worked out a technical guideline for different places to offer the differentiated and well-targeted measures. We emphasize that there should be particular attention paid to the travel history, the close contacts, and the current health conditions of the targeted people. And we should review the risk of epidemic spread based on the above-mentioned factors. So the individuals are classified as high, medium, and low risks. The categorization of the risks are also based on the diagnostic and treatment guidelines to have differentiated management. Let's continue. On the right, on the third row, the reporter in black. Thank you. I'm from Changjiang Daily, the Yangtze Daily. In some localities, there have been a citywide disinfection. For example, in the residence communities, there have been specific disinfection measures, and also using drones to have the spraying of the disinfectants. So what is your comment on that? Professor Zhang, please. I think I've already answered the question repeatedly. Indeed, it is a hot topic, and it does happen in some localities as covered by the media. Drones or the various vehicles are used to have the disinfectant sprayed, but I think it is more of eye-catching. I think we should pay more attention to the result of disinfection rather than the form of disinfection. So we should guard against such eye-catching practices. We've already worked out technical guidelines and standards for environmental disinfection. In particular, we have strengthened the knowledge awareness and advocacy in this regard.
And this cannot be separated from your proper reporting. In the scientific, disinfection and precision policies should be adopted in this front. This part of the efforts have to be done by various stakeholders. On 29th of February, the Comprehensive Working Group of the Joint Mechanism has issued a document on strengthening disinfection efforts during the epidemic unfolding. And in this notice, over-disinfection was mentioned in particular. Emphasis was given for the prevention against over-disinfection. And 6 points were mentioned. I'd like to elaborate on these 6 points. First, we do not recommend large-scale disinfection on outdoor environment. Second, in rainy or snowy days, we do not recommend disinfection on outdoor environment. Third, outdoor air is not recommended to be disinfected. Fourth, it is not recommended to sprinkle or spray the disinfectants on human bodies. And fifth, the ponds and artificial lakes are not recommended to take disinfectants. And sixth, do not recommend disinfection of indoor air when there are people indoors. So these are the 6 areas where we should pay special attention to for over-disinfection. Next question. The journalist in white on the 4th row from the left side, please. Thank you. China Family Household reports flights and trains are taking more and more passengers. So what should passengers pay special attention to? I'd like to ask researcher Zhang Liubo from CDC to take the question. 4 tips for the passengers. First, remember the schedule of the flights and trains. Don't come to the train station or the airport too early, so as to avoid the contacts with the crowds. And stay away from a semi-confined place or a closed place. Traffic authorities may give notices as well. For example, they require that passengers cannot enter the stations earlier than 2 hours than the departure time. Second, we recommend personal protection, including the wearing of masks throughout the ride. Avoid the touching of public places and services. Ensure social distancing. Avoid unnecessary talks. Frequent hand hygiene practices if you believe that your hands have touched anything that may be a source of contamination. Third, during the ride, passengers are recommended to talk in low voices. If there are coughing or sneezing neighbors, you should, if you want to cough or sneeze, cover your mouth and nose with your elbow. And if you have to go to the toilets, the surfaces that you touch, after you have touched these surfaces, frequent and timely hand hygiene practice is recommended. Fourth, if conditions allow, distance yourself with your neighbor. If it is allowed, then 1 seat as the separation is recommended. Next question, please. A journalist from the 5th row on the left side, please. From Shenzhen TV. Reports have it that there are 11 staff members, employees got infected in a 30 people attended meeting. As businesses resume their operations, meetings are inevitable, so what are the points that we should pay attention to? I'd like to ask researcher Zhang Liubo to take the question. Yes, indeed, businesses need to convene employee meetings. And for meetings, it usually involves a small crowd of people. Therefore, prevention control are essential. 4 points as suggestions. First, the meeting room should be well ventilated. As weather gets warmer, we suggest ventilation by opening the windows. If a centralized air conditioner is used, we suggest the use of free air. Maximize the ventilation volume of the fresh air inflow to ensure the freshness of air. Second, prior to the meeting and after the meeting, the table surfaces, the arms of the chairs, and the surfaces of the ground of the meeting room should be disinfected and cleaned. Third, minimize the frequency of the meetings and shorten the duration of each meeting. Distance the participants to the meeting, and participants should wear masks. Fourth, If a video conference is possible or a WeChat conference is possible, we suggest a replacement with the physical meeting. Thank you. Thank you. Last two questions. Journalist from the fifth row on the right side, please. From 健康报 JKB. In Baodi over Tianjin, there was a shopping mall which experienced a cluster case. So in places like supermarkets and shopping malls, can the public go to places? What are the corners that we should pay special attention to? What are the measures adopted on the centralized air conditioning system? I'd like to ask researcher Zhang Liubo to take the question. Again, this is a lively discussed question because shopping malls and supermarkets have a close bearing with the daily life of the general public. When people are asking, can supermarkets and shopping malls be opened? My answer is they must be opened to meet the needs of the general public. They have to be opened for consumers and customers. You are suggested to minimize the frequency of supermarket and shopping mall visits. If you have to go, then shorten the time. You have to shop the daily necessities. And you are not suggested to do a random shopping. As a journalist has asked questions on the key places and points, like the lifts, the air conditioning system, what should be the disinfection and cleansing efforts be carried out? I've prepared a list, and I think not only places, as you've mentioned, there are other places that we should pay special attention to. First, for the escalator lifts and the lifts, the ground surface, the buttons, and also the arms of the escalators should be disinfected more frequently. The counters should also be frequently disinfected. Second, for the central air conditioning system, we know supermarkets are usually spacious. So being it of a fan coil system or a free air system, we suggest the use of a free air system to the maximum. If free air handling is not possible, then we suggest physical ventilation by opening the doors or windows. Third,
I think which is more critical or crucial even, that is to set up a health declaration system and also body temperature monitoring system to identify the abnormalities among the staff and also for the customers. We need to have early detection of the abnormalities. And fourthly, in shopping, there should be a certain distance kept. The farther, the better. I think at least 1 meter. Whether you are at the cashiers or you are weighing the products you are buying, there should be at least 1 meter distance kept apart. And also try to use the NFC approach to have the electronic account settlement, and also emphasize the hand hygiene. And seventhly, if you find any suspicious signs like abnormalities in body temperature, then you should report to the local CDC and have their guidance to have the environmental disinfection. Last question. On the left, on the fifth row, the third lady reporter. Thank you. From CETV. Recently, localities in China are recovering their business or operations, and kindergartens are also planning to reopen. So what are the protection measures for the kindergartens? Professor Zhang, please. Indeed, people are quite concerned about the safety in the kindergartens or the nurseries. I think there are three aspects. First, before the reopening, the kindergartens should have a thorough disinfection and the cleaning. It must be ensured the freshness of air indoors and also the adequate supply of the protection materials. And the staff working in the kindergartens should be well educated and well trained to use the materials. And the second, to have the baseline information collected concerning the teachers and the kids. And secondly, once the kindergarten opens, if the epidemic is over, then we can just follow the routine procedures. But if there are still cases identified, then there should be precautions adopted. There should be emergency response plans developed and put in place. Also, there should be disinfection concerning the goods and products used, as well as hand hygiene. Apart from that, thirdly, in case of suspicious cases or suspected cases, then we must follow the emergency response plan to deal with such suspected cases. Thank you.